Skuktash, I'm Dr. Rodrigo Villar, and I'm a pediatrician and public health doctor here on the Tohono Nation. I'm here with Dr. Regina Ross, who is also one of our family physicians. We're going to talk a little bit about what we know for coronavirus vaccinations.
Skook Siarik. I'm Dr. Ross. Nice to be here today. Thanks, Dr. Villar.
So, Dr. Ross, today we wanted to talk a little bit about concerns that pregnant women might have with vaccination. So we know that when the studies were done with the COVID-19 vaccines, they weren't conducted with women, but many women did not know that they were pregnant during the study, and things turned out well. So when a pregnant woman right now has questions about whether she should get vaccinated, what are some of the things that we should coach her with or share with her so that she can make an informed decision?
That's a great question, and it's a question that I get pretty regularly in clinic. I'm pregnant. Should I get the COVID vaccine? And for most people, getting the COVID vaccine as soon as possible is the safest choice. However, trials testing the vaccine in pregnancy and breastfeeding have not been completed yet. So we're here today to help you make an informed choice about whether to get the COVID vaccine while you're pregnant or trying to get pregnant. It basically comes down to two options. You can either get the COVID vaccine as soon as it's available, or you can wait until more information is available about the safety of the vaccine in pregnancy.
So what are the benefits of getting a COVID vaccine if you're pregnant?
Well, as we all know, COVID is very dangerous, and it's more dangerous for pregnant women. People who are pregnant are 5 times more likely to end up in the ICU if they get COVID while they're pregnant. Also more likely to be on a ventilator than people who are not pregnant. There's also more risk of complications with the pregnancy as well.
So, Dr. Ross, let's talk a little bit about how COVID vaccine works or how effective is it?
Yeah, this vaccine is incredibly effective. It's 95% effective at preventing COVID infections in people. And that's super important as the levels of COVID in the community increase, everyone's risk increases. So getting the vaccine will definitely help you to prevent getting COVID, and it'll help other people around you from getting COVID as well.
Can the vaccine give you COVID? That's a question that I get asked a lot.
I also hear that question quite a bit. And the vaccine can absolutely not give you COVID. It is not a live virus. It cannot give you COVID.
So how do we explain to people who got one dose of vaccine and then they got COVID a week later?
So they were either infected before they got the vaccine or they got infected after, because you don't get full immunity until after your second vaccine, a couple weeks after it. So once you get the second vaccine, about 2 weeks later, then you're 95% protected against getting COVID.
So with the vaccines that we have currently, the Pfizer and Moderna vaccine, you get 2 doses. The first dose, and then about 4 weeks later, your second dose, and we consider you're fully immunized after those 2 doses, and what your body can protect itself is about 2 or 3 weeks after that, correct?
Correct.
So let's talk a little bit about the risks of COVID vaccine.
Okay, that sounds great. So the risks of COVID vaccine specifically pertaining to pregnant women are that we don't really know yet. So the vaccine was tested in over 20,000 people, and there were no serious side effects. However, it was not tested in pregnant women. We do not have data on whether the vaccine works as well in pregnancy as it did in the non-pregnant people. But we do have data on whether there are unique downsides in pregnancy, like different side effects or increased risk of miscarriage or fetal abnormalities.
So what does that mean exactly for a woman that's pregnant?
Well, that's a good question, and it's a complicated one for sure. So people getting the vaccine will probably have some side effects, as we all know about the sore arm and the body aches. And about 1% of people will get a high fever over 102 degrees. And a high fever during the first trimester of pregnancy might increase the risk of congenital defects or miscarriage. So for those reasons, you might want to delay your COVID vaccine until after the first trimester. And the CDC does recommend using Tylenol in pregnancy if you have a high fever.
Great. So if a woman decides to get the COVID-19 vaccine during pregnancy, she should talk to her doctor and see when the timing is best for her.
Exactly.
So Dr. Ross, my niece is pregnant.
Oh, congratulations.
Well, thank you. What would you say, what do the experts recommend for her to help make a decision about COVID-19 vaccine?
Well, that's a great question. We know how dangerous COVID is. However, there's no clear guidelines from the experts as far as the recommendations for the COVID vaccine. The Society for Maternal and Fetal Medicine strongly recommends that individuals have access to COVID vaccines, and that each person has a discussion with their doctor about what is right for them. The American College of Obstetrics recommends that the COVID vaccine not be withheld from pregnant women who meet the criteria for vaccination. So it's all about what your niece's risk is and what all pregnant women, their risk is, to discuss with their physician.
So I appreciate that. I'll tell my niece to talk with her doctor to help make that decision.
Well, that's a great idea.
So we know that studies are now undergoing to look at how COVID-19 affects pregnancy, and we'll have more information to share with our patients in the near future.
Exactly.
So right now, would you recommend that if a woman is pregnant and she would like to get vaccinated, she speak with her doctor?
Absolutely. And there's some different ways to help her and her physician decide if that's right for her. So first, you have to think about your risk. So there's a few different options when you're looking at your risk. So we know that some people are at higher risk than others. So people that are at higher risk are those who have contact with people outside the house who do not wear masks. If you're over 35, if you're overweight, if you have other medical problems like diabetes, high blood pressure, if you smoke, if you're in a community that has high rates of COVID infection, or if you're a healthcare worker.
So that question comes a lot with healthcare workers. We know that most healthcare workers in the United States are women. So ideally, we will have some better information for them in the future.
Absolutely.
How could you reduce your risks from COVID? How do we reduce our risk from getting COVID, especially if you're pregnant?
Well, the risk reduction is the same if you're pregnant, if you're not pregnant. So definitely you want to avoid gatherings with people without wearing masks. You want to stay 6 feet apart. You want to wear your mask. You want to wash your hands. Those are the big ones.
And that's, I think, what we tell most pregnant women as well, is make sure that they're staying safe, eating healthy, minimizing how many people they're around, because they don't want to catch colds and other illnesses. And now we don't want to catch COVID and spread COVID to anyone, especially someone who's expecting a baby. So wearing our masks, avoiding gatherings, washing our hands frequently, avoiding crowds are very important during pregnancy.
Absolutely.
So how would you counsel a mother who is breastfeeding if she wanted to get the vaccine?
Well, that's a great question. So there's absolutely no reason not to get the COVID vaccine if you're breastfeeding. The Society for Maternal Fetal Medicine reports that there's no reason to believe that the vaccine affects breastfeeding at all. When we have an infection or get a vaccine, our bodies make antibodies to help fight off that infection. And those antibodies that are formed go through our breast milk, and they go into the baby to help protect the baby from getting sick in the future. And since the vaccine does not contain the virus, there is no risk of passing on COVID through the breast milk from the vaccine.
So that's important to know. So women who are breastfeeding can safely continue to breastfeed and get the vaccine.
Absolutely. Totally recommended.
Great.
Well, in summary, I would just like to say that COVID seems to cause more harm in pregnant women than in women of the same age who are not pregnant. And the risks of getting the COVID vaccine during pregnancy are thought to be small, but they're not totally known yet. you should consider your own personal risk of getting COVID. If your personal risk is high or there are many cases in your community, it probably makes sense for you to get the vaccine while you're pregnant. Whether to get the vaccine during pregnancy is always your choice.
Thanks so much, Dr. Ross. I'm sure this will be very helpful for women who are concerned and have those questions.
Well, thank you, Dr. Villar. Thanks for having me today.